I am Dr. Janine Keever. I work at Southern New Hampshire Health and I practice at Amherst Obstetrics and Gynecology in Amherst, New Hampshire. Pelvic pain is super common in women. I see patients literally every single day for pelvic pain. And there can be a lot of different things that cause pelvic pain. And since I'm a gynecologist, a lot of times the primary care docs will send patients to me because they think maybe their pain is related to their GYN organs. So my job as an OBGYN is to do a little detective work and figure out a little bit about the history, a little bit about where the pain's coming from, how long it's been there, what causes it to get worse, what makes it improve. One of the things that we look at that's more common than you would think is the bladder, and is actually bacteria that's leading to infection, or is it a thing that we call interstitial cystitis or painful bladder syndrome? So the way I think about the bladder is it's like a balloon, and inside that balloon there's a layer of clear gel, and inside that layer of gel are nerves and blood vessels. So when you have a bacterial infection, bacteria eats away at that gel and exposes the nerves, and then the blood vessels are exposed, and you'll have blood in your urine. You'll have nerves exposed, so you'll have urinary frequency, urinary urgency, sometimes incontinence. So if we can figure out what's causing the gel to be eroded away, if it's not bacteria, what could it be? When I've decided that I think that the pain might be coming from the bladder, what I look at is a history of what they eat and drink. Like electrolytes, I see a lot of people drinking electrolyte beverages all day long, and it's that potassium that's in the electrolytes that can just irritate the bladder wall. We also see it with different fruit juices, and sometimes people will start taking supplements like cranberry supplements and the cranberry juice that their mom told them to drink because they had a bacterial infection. But what if you don't have bacteria in there? So what you're doing is you're pouring that cranberry juice in, making your urine more acidic, which is actually irritating the walls of the bladder, and that causes pain. So oftentimes what we'll do is I'll tell people that we can go ahead and have you stop the things that we think are the triggers, really focus on water and allowing your bladder to just be soothed and healed by staying away from the things that cause the irritation. Doesn't mean you can never have those things again. It just means that if you decide you're gonna have a big glass of lemonade and then you have a little bit of pain some hours later, be like, that's my lemonade. Back away from it, allow your bladder to heal, and then you may be able to have a little bit here and there. Sometimes when people come in and they're in a lot of pain, I'll do a thing that we call a bladder rescue. And so what I do is I'll put a solution through a little teeny catheter that goes in the bladder, and then it goes in and soothes the lining of the bladder, and their pain goes from 8 out of 10 to 0 in like seconds. And oftentimes these people have had pain just for years. So that can be very helpful. There are other medications that you can take also, prescription medications that will help to rebuild that bladder wall, but they take a while to work. So people usually want to have that pain go away right away. And so those are the ways that we do it. If I can take care of things, while they're seeing me, and I can figure out that this may have something to do with the bladder, and they can just fix their diet a little bit and make this a lot better, then when they get to the urologist, then the urologist can do a little bit more of a deep dive if the diet changes aren't working. And that's kind of how we work together at Southern.